The heart is a muscular pump with 4 chambers, 2 thin-walled atria and 2 thick-walled ventricles. The atria collect blood returning to the heart, whereas the ventricles pump blood from the heart. Oxygen-poor blood enters the right atrium through the superior and inferior vena cava. The superior vena cava collects venous blood from the head, neck, upper limbs, and thorax. The inferior vena cava collects venous blood from the abdomen, pelvis, and lower limbs. Venous blood from the heart itself enters the right atrium from the coronary sinus. Contraction of the right atrium forces blood through the right atrioventricular valve, also known as the tricuspid valve, and into the right ventricle. Right ventricular contraction then propels the oxygen-poor blood through the pulmonary or semilunar valve and into the pulmonary trunk. The pulmonary trunk divides into a right and left pulmonary artery, which carry oxygen-poor blood to their respective lung for gas exchange. These are the only arteries that carry oxygen-poor blood. Oxygen-rich blood returns from the lungs through the 4 pulmonary veins to the left atrium. These are the only veins that carry oxygen-rich blood. Contraction of the left atrium forces blood through the left atrioventricular valve, also known as the bicuspid or mitral valve, and into the left ventricle. Left ventricular contraction propels the oxygen-rich blood through the aortic or semilunar valve and into the aorta for distribution to the body.